We're going to call the City of Franklin Board of Health meeting, April 11, 2022 to order. Roll call, everybody is here. So approval of the minutes from March.
Move to approve.
Second, any discussion? All in favor of approving the March 14, 2022 meeting minutes? Say aye.
Aye.
Okay. No citizens for comment period. Is there any unfinished business?
There is no unfinished
All right.
business.
Then we are not going to go into a closed session. We will let Darren kind of explain what had happened at our meeting.
Yep, so nothing under 6, nothing under 7. Under administrative report, hi everyone, how are you doing? I'm Darren Roush. Some of you remember me from a few years back when I was in this interim role.
Yep.
But my day job is at the Greenfield Health Department, and I'm just helping out to cover some statutory needs here at Franklin until we hire somebody. So
Thank you.
great to be with you again. Just wanted to start with announcements. Under announcements, I have National Public Health Week, which was last week. So we had a lot of Facebook posts, we had a lot of advertising out to city staff. Specifically, there's a 2-mile run walk coming up, and city staff will be incentivized for attending and participating in that 2-mile run walk in May on the 14th. Lauren has posters if you would like a poster. Also under announcements, City of Franklin spring election, Alderperson Barber did win in District 5 once again. We understand that mayoral appointments will happen at the April 19th meeting, so how they reshuffle those seats, could be you again, it could be somebody else.
He doesn't really reshuffle. He kind of keeps everybody.
Well, that's okay.
We're okay with that.
Some people like change, some
unless
people
you want
don't.
to ask them to consider a reshuffle.
Some of my colleagues do want to get rid of some people on their boards of health sometimes, but I've heard nothing but good things. Let's see, under personnel updates, the Health and Human Services Director position has been posted. It was the original posting date had an expiration or close date of that posting of March 10th. It was extended to March 25th. It's now officially closed, and actually we had 6 candidates that we identified for interviews. 5 interviews occurred. One person had found another job in the interim, so they stepped aside. So we conducted 5 interviews on Friday, April 8th. At this point, myself, Henry, and Lori were all on the panel, along with Peggy Steno, Director of Administration, and Dana Zahn from Human Resources. So we met on Friday, long day. I think we were there from 10 till 4:30. Going through the interviews, we kind of took the weekend to think on things, and we're going to kind of reconvene virtually, those of us internal to the city, myself, Dana, and Peggy, with the mayor tomorrow to talk about next steps, to see what he wants to do. It's quite possible that he might want to interview, to do a second interview with a couple candidates or 3 candidates, but we're going to have that conversation tomorrow. So that's where we stand at this point. We had some really great interviewees, and the process went really, really well. So what happened last time, just to kind of go through my notes here, the Board of Health, by state statute, is responsible for selecting and kind of supervising that health officer. So by city ordinance, the hiring process requires a Board of Health recommendation. Board of Health chairperson and HR were involved in the interview process. We felt that the mayor may want to interview some people, so that's kind of where the process is now. The Board of Health will ultimately make a recommendation on the selection of the health officer to the mayor. And that's kind of where we left it on Friday, right, Henry? So we'd give the discretion of the top candidates to the mayor. If he chose to interview them, then he would determine and then reach back to us with questions, thoughts, that sort of thing. So really kind of using a consensus model. Generally speaking, go ahead.
Would we get a chance just to meet this person before we're asked to nominate the person to
That'll-
the council?
That is something I don't believe happened last time.
No.
I believe last time the panel recommended a name and the mayor moved forward with making contact and then started the process with HR. We kind of touched upon that. We can certainly take it back to them if that's something.
I'm just curious. I don't know if there's a need for it, but I just was wondering
I
if.
think at the next meeting after they were chosen by the panel, they came to the next meeting and introduced themselves.
That's all I'm asking.
Yeah, and I forget the transition last time, what space it was between Courtney accepting the position and coming
Right.
in.
There was
But I
an
thought
issue
there-
with Bill because he was still getting paid.
Yeah, the time period there was a little bit longer, obviously. I think I was interim for like 9 months last
Right.
time. So that's where we stand right now. Nothing too significant update by way of names or any real specifics, but that process is going to be moving forward. And I would like to believe that within the next week we'd be moving towards filling that position and getting close to making that transition. So.
Were most of them local to Milwaukee area or southeast Wisconsin? or-
Southeast Wisconsin.
Yeah, everybody was fairly local, and there was a good number of the candidates had public health experience.
So they know the turf.
So yeah, I mean, from a variety of different backgrounds, nursing, community health, environmental health. So it was a pretty diverse group. I mean, we've known, Lauren and I have known positions across the state that have had very, very challenging recruitments. Like the city of Appleton, it took them almost over a year, 9 months to fill that position. North Shore Health Department, it took many, many months to fill that position, and it was only recently filled about 3 weeks ago. Washington and Ozaki is still looking for a health officer for their combined department, so it's been really difficult to fill some of these positions. So I think we're fortunate that we had 6 candidates for an interview and 5 really strong interviews. All right, any other questions on that? All right, next on my list is a community health assessment update. That is a process that the health department is going through this year. The core team is currently working on securing a location to host the next community meeting. I think it's the first community meeting, right, Lauren? And at this meeting, this is where the data will be shared, both from the community survey, the key informant interviews, and focus groups will be shared. And really, the purpose of the first community meeting is to get the feedback from the community. You know, we're going to tell the story of this is what the data shows, what are you seeing, what are you feeling, and really gauge that input. Audience participation or community participation will lead to the selection of future areas of focus for the community health improvement plan, and that's always based on community need and priorities. So invitations for that will be coming out as soon as the location is secured. And it's important to probably note too, I think all of you note that the process is a bit delayed because we had this pandemic for the last couple years. So many health departments, Greenfield as well as Franklin and others, are a little bit behind on these processes because the pandemic got in our way. And then next on my list, I have legislative updates. So we had listed on the agenda Senate Bill 312, and Senate Bill 312 was passed. And this is the bill that allows the allows the local government to appoint a physician assistant, advanced practice registered nurse, or both to the appropriate board of health in lieu of a physician or a registered nurse. So this came to the attention of legislators from other rural parts of the state where they said it was hard to find a physician to be on the board or a registered nurse, so they wanted to open that up to other medical practices. Made complete sense. This was something that both the statewide local association of health departments and boards supported, as well as the Wisconsin Public Health Association. Passed the Senate as well as the Assembly, and I believe the governor signed it a few weeks back. So that's in place. So down the road, should Franklin choose advanced practice, registered nurse, or a physician assistant would be another medical type person to put on the board as options. And I think that's a good addition. The next one is Senate Bill 1000, and Senate Bill 1000 did fail to pass. This is one of those bills that was limiting public health authority, so effectively it's dead because the legislative session is over. But under this bill, the local health officer's action related to infectious disease could not exceed 60 days. So this was basically the 60-day limit on orders. So if I was to put in place a mask mandate, it could only exist for 60 days. If I was to put into place a restaurant closure order or something along those lines, or closing a daycare or something along those lines for a communicable disease outbreak, could only be in existence by my order for 60 days and would have to be extended by a governmental body. So in this case, it'd be the Franklin Common Council that would have to extend that. That bill has died. I'm sure we're going to see bills like this come back again. On a national proposal I was reading is that there's thousands of these like limiting local public health authority bills and that are trying to get passed or have been passed across the country. So it's certainly a hot button topic at the tail end of the pandemic because there's just a lot of consternation about public health orders. So that's where it sits now. It's dead for this session, certainly something we want to watch for the future. And then Assembly Bill 1131. This was also related to a corresponding Senate bill. This one is also dead. It did not advance this session. This was basically, this is the legislation that was going to basically change the language. So the language in statute currently reads, local health officers may do what is reasonable and necessary to prevent and control communicable disease, forbidding public gatherings when necessary to control outbreaks. Basically, this bill was going to prohibit a local health officer from ordering the closure of or forbidding gatherings in places of worship to control outbreaks and epidemics. So it was, again, going to kind of hamstring those orders. And again, none of myself nor my colleagues are looking to go out and close anything out of order. You know, we're judiciously, prior to COVID, have used these sort of orders and this sort of language very, very minimally. It's to close the restaurant that's causing a hepatitis A outbreak, to close a daycare for, you know, a norovirus outbreak. But we're talking like small, limited things, and we have science to say this is what we're going to do. Again, a lot of these bills are things that we're going to want to watch in the future because it's something that's going to probably come up again in terms of limiting or trying to limit public health authority. The other more probably scarier thing within this Assembly Bill 1131 is that it said that local health officers cannot put names on the TSA list for do not fly. And it's pretty significantly problematic because we've had, in my career, tuberculosis patients or COVID patients who are positive and infectious who are planning to fly somewhere. And we've needed to call and negotiate with TSA and the Centers for Disease Control. No, Henry's got a communicable disease. Henry can't get on that plane. And that's important because we don't want to put somebody with the disease on a plane. So there was a number of other things kind of built into this that could be really potentially problematic. If Henry was infectious with tuberculosis and got on a plane and flew to LA, that entire plane would be, you know, subject to come down with tuberculosis, and that would not be a fun outbreak or anything like that. So these are the things that we need to continue to watch kind of going forward in the future. Glad they're dead for now, but you know, I'm sure they might come up again. So any questions on any of the legislative updates? A lot of activity. I think all three, or the last two bills kind of came in that flurry of legislative activity in the last like week of the session and didn't advance, obviously. So that's not a bad thing. All right, so I'm going to move on to the public health nursing report. In the city of Franklin, the COVID update, cases continue to kind of decrease, plateau, however you want to look at it. Basically, over the last several weeks, we've been at levels, you know, across Milwaukee County and Franklin and Greenfield that we haven't seen since last July. So very, very low levels of transmission. We've started to see a little bit of an uptick, but when you're so low, a couple extra cases, you know, look like an uptick. I'm not making too much about that at this point, but you can start to see on the county just kind of this little tail that's moving up. Could be a lot of people traveled for spring break, could be a number of factors, but here I would say we're still at a very, very low level and pretty much plateauing. Carefully, obviously, watching what's happening in other parts of the country. As a result of our low transmission, there's decreased contact tracing because there's just not that many cases. The average case count has been less than 6 cases per week. So 2 contact tracers are done with their contract effective this week on April 15th, and we'll continue to assess any post-spring break numbers, any post-Easter, Passover holiday type numbers to continue to look at that caseload, the internal capacity. and the funding in terms of how, and what level we need to staff. So there'll be 2 remaining contact tracers at this point hired from the staffing agency.
So who's left? Because we all communicated.
Right now, we still, all employees are left that
Okay.
we were contact tracing
Yeah.
with, and we'll send an update, but Deb and Shronda are the ones who will be done. And then
Okay.
Veronica and Nell will be remaining.
Or grant money for that.
And we do use a grant for that, correct?
Right.
Mhm.
But the ones that our contracts are up, do we have additional grant money that we're not going to be using?
We have a variety of different initiatives that it can be used through for COVID
Okay.
recovery, so it will just be shifted then into other uses.
And I think we're all kind of across the state trying to calibrate the amount of staffing we need. So I know in my department, we've shifted some of the staff into other projects using different funding sources. So we're trying to minimize the staff that are tied to COVID. I think to your question, Henry, the COVID money that wouldn't be used by these folks will kind of sit there. And a lot of that money carries over into 2023 or 2024 as far as an end date, and that may even be extended. So the money, as I would look at it, is still there. If we need to surge in the fall, it would be available for a surge. But there's very specific things you can use it on. It's generally quote unquote COVID mitigation control response or quote unquote COVID-like response. So doing preparedness training, preparedness exercises, getting staff trained in communicable disease control or public health emergency preparedness, but it is a pretty narrow scope of what you can spend it on. All right, under 2, other communicable disease referrals, nothing significant, no update today. Under 3, human services referrals, no significant update except the one case. Did you guys talk about this last month?
We briefly discussed that the house is being sold.
Yeah, so the brief update on the house that you mentioned last month is that the house has been sold, the property has been cleaned out. I've spoken with the owner and the city staff, so both health and inspection will be going in there tomorrow morning. We will be going in there, myself specifically, to clear the health hazard. So at this point, with all the stuff removed, it's just putting eyes on it, verification, health hazard gone. Inspection staff is going in specifically to assess if there's any building issues, electrical issues, plumbing issues, because the condition of the home previously didn't allow them to do a thorough investigation. So I expect by 10:05 tomorrow, the health hazard will be gone, and we'll have that communicated in writing within the next 24 hours. And then if there's anything from the inspection services side of things, like, hey, the electrical issue may have caused the fire that originally brought the city into the home, we'll get that fixed, and they'll take it from that direction. So, knock on wood, nothing else has been happening under health or human services referrals. And for community health programs, since Lauren was able to join us today, I will just turn this section of updates over to her.
I don't have many more updates than last time, but a few more details on the events that are coming up in the future. In June, we are still planning for our bike rodeo, which again is when children learn to master safety skills out on the road. So we are having calls out for volunteers, sponsors, participants. Currently and in the near future, we'll be ramping that up. We also have the Franklin 2-mile run and walk. If you've seen this on social media or on the city website, we've started pushing this out with details for how people can register, but also be involved. So we're aiming to have a variety of volunteers help with that. And the main organizations spearheading that are the Health Department in partnership with Coalition Franklin, the Substance Misuse Coalition here in town, Fit Franklin, which is made up of the Recreation Department here in Franklin, the school district, local businesses, so Apostoli from Mimosa and George from Sugar and Flour, and Ascension Health is also a player on that. So they are all coming together to put that on, and we really hope that you guys will help spread the word, because it was a quick turnaround, not knowing how quickly this group could reconvene to plan it as a coalition and not knowing where the pandemic was going to be. So we would really appreciate any help we can get from you guys as the Board of Health within your network to spread the word. Darren mentioned this, but we have some posters over there if you have somewhere in a high visible area you'd like to advertise. I also printed some flyers that you guys can take to share now that we officially have approval from the Parks Commission as of tonight to do Lion Legends that will be moving on to the Common Council as well. So feel free to take these. And I included in the packet but just the different opportunities to sign up to volunteer. If you know any groups that are looking to get involved, have a team, walk or run, the goal of the event is really to increase community connectivity, so we want everyone to feel connected and feel a sense of belonging. So our main theme is just uniting the Franklin community again after this pandemic. That's where we're at.
Lauren, who are some of the sponsors for the bike rodeo?
They did not have the second page done, so the planning committee on that doesn't have a verified list of sponsors yet, but I do know it's growing to be pretty robust. So I'll definitely bring more details as they solidify those moving forward.
All right. Any questions for Lauren? All right, I'm going to take the liberty as the interim health officer to just bounce back to announcements. I have this fancy plaque in front of me. The state health department and the office of the governor have been very purposefully going out and thanking local health departments for all the great work that we and they have done across the state over the last 2 years. So this is an official commendation honoring the Franklin Health Department signed by Tony Evers just about a month ago. And he writes, the Franklin Health Department has made invaluable contributions to the Franklin community and to the state of Wisconsin. Franklin Health Department has provided outstanding and exceptional public service to the people of Franklin in carrying out its duty to safeguard the health and safety of Wisconsinites over the course of the coronavirus pandemic. And in addition, despite incredible challenges and pressures, including numerous changes to staffing and resources, the Franklin Health Department has prevailed, continuing to build and cultivate key partnerships with local and state organizations to advance public health in Wisconsin. And the health department has remained committed to mobilizing every resource available to protect the health of the community. And staff have tirelessly and selflessly devoted themselves to saving the lives of the people they serve, working tirelessly during these unprecedented times. And he goes on to say that we, the department, have demonstrated unparalleled commitment and devotion to the prevention of illness, promotion of health, and the protection of all Wisconsinites through its response to COVID-19. And its selfless and boundless service to Franklin cannot be stated or overlooked. So I know you will all like to touch this and hold it as well.
I think that should go before council.
It probably should, and I
It's a great
I
idea.
have a picture of it I was going to send to the mayor, but we can
Yeah.
certainly make that happen.
I can recommend it to him as well.
There you go.
Excellent. Thank you.
So it was nice to see it in the mail. It's nice to be honored and appreciated. Even 2 years later, because it was a pretty monumental 2 years for all of us, and I don't need to tell you guys that because you know what happened. You know what we lived through. All right, so getting back on schedule, environmental health and emergency preparedness report. Under licensing and inspection updates, there's no real updates there. I know there's a few new establishments that are coming to the city of Franklin in the coming weeks and months. A couple of those are going to be at the Rock Sports Complex. So there's a Doghouse restaurant, and there's going to be the golf bays. The Lux golf bays will have some food as well. So those are two things that our staff are working on. And I believe Angie mentioned there's a Jersey Mike's or a sub shop that's opening. So that's kind of what's happening there. So kind of quiet in that world as we get geared up towards relicensing in June. And then under environmental health referrals, there are no updates for this month. So any questions?
I'll ask the mayor to get this from you.
That's great.
All right.
It's his choice, but
Any other updates or any questions anybody has?
no.
Need a motion to adjourn?
Motion.
And second? Any discussion? Hearing none, all in favor of adjournment?
Aye.
Okay.